thing that's very important but often forgotten is to sit down with other members of your team, your other practice partners, key elements of your staff, and write out the leadership plan so that you know where you're trying to go and how you're going to get there. What goals do you have and when? What's your time frame? Who really needs to be involved in each element of that? Writing it out where you can see all the pieces and identify the pieces that you might have normally been forgotten or otherwise forgotten is very important. There's several key parts of a written leadership plan. One is your overall goals. Second, how each part of your each person in the practice, each position in your practice is going to feed into those goals. Third, what is your individual structure for making decisions on the elements of your plan? Who's going to be involved in the patient portal element? Who's going to be involved in plan visits? Who's going to be involved in patient registry? And know who are your resource people, who are you going to go to for that, both inside and outside the practice, and get an idea of how all those elements are going to fit together. That might well involve some financial leadership plans also, in terms of how are you going to do, what each element is going to cost, what you expect the time involved to be for those individual pieces, what kind of resources are you going to have to put in to support each member of the change team, and how can you provide leadership all along the way. The other element of the leadership plan, which is really important, is to make sure that you're fitting all those pieces together over time, and that each element feeds into each step and how that they can mutually support each other. In this regard, it can be helpful to sit down and write out a vision on your own. The next step is to look around and see what other people have done. There are many great docs out there who are trying to do a good job. There are many practices who've been successful in some of the same ways you want to be successful. So use those resources. It can be very helpful to delegate parts of the leadership plan to other key members of your staff and have them write up what they envision for that element, for several reasons. One, to get other input and other ideas, second, to make sure that they are understanding where you want to go. In addition, it will give you a great idea of what elements, in a very practical way, need to happen. Your clinical nurse lead may have a lot of more awareness of what really needs to get done in a given area than you had imagined. And his or her ability to write that element of the leadership plan, or at least write the critical elements to be considered for you as you're developing the leadership plan, can be very important. It also engages them in the process early on so that they can really feel they're part of it from the ground up.